heel pain now. Anybody that's had heel pain for plantar fasciitis knows how horrible it can be and how painful it is to get up in the morning and to walk. So we found in our research that anybody with limited great toe extension is prone to getting heel pain for plantar fasciitis. This is due to the origin and insertion of the fascia with the largest slip to the big toe. This would be an initial program that I would start my patients on at the Human Movement Institute on Marvelous Monday, where it's Mobility Monday. This is what I would teach the patient to do to have a healthier foot and to restore heel pain once and for all. Restore big toe extension, I would tell them. I would tell them to pull their big toe, spread the big toe, and extend the big toe. And while you're at it, you might as well extend all your other toes. You can mobilize where you're extending and flexing, and or I can hold a manual stretch for 30 seconds to a minute, 2 to 3 times, twice a day. Next, anybody with heel pain should check their deep posterior compartment and their superficial posterior compartment of the leg. The gastrocnemius and the soleus are known to cause heel pain, particularly referred heel pain. So if you get that burny, achy sensation at the bottom of your foot, an arch of the foot as the day goes on, and you find that you've got nasty trigger points in the gastrocsoleus complex, make sure that you mobilize these muscles as part of a self-care program. I would start with an initial dose of calf muscle rolling, 5 to 10 minutes, at least a couple times a week, and definitely after being on your feet all day. We want to prevent this musculature from tightening all night when you sleep with your foot down, and then your wife folds the blanket over the edge of the bed and it puts the foot down in a tight position all night. Say, honey, we're going to pull that out of there, get my foot unentrapped so I can start to stretch some of the tissue in the back leg. I can cover more ground by using a large ball to mobilize the posterior leg. Here I'm starting with just some rolling, but I really prefer surgery without a knife, tacking, twisting, and shearing muscle between different muscles, between and amongst the fascia and the bone. Anywhere that's tender or tight, from the back of the calf all the way down to the Achilles, even the inner leg, 10-15 minutes should be spent. Next, we're going to prepare the fascia for mobilization. Notice that the fascia is on slack when the toes are curled. So this is a good start for those where it's really painful. However, we want to put the windlass mechanism on tension by extending the toes to better mobilize the fascia. I'm doing the distal aspect of the fascia, and I'm working all the way up to where it starts on the medial calcaneal tubercle. That's the origin of the plantar fascia. Don't forget that this is the largest ligament in the body. It can withstand up to 10 to 15 times your body weight before it tears. When I had it in both heels, I would prepare my musculature in my leg, and I would prepare my plantar fascia before I would load it to avoid the horrible morning pain. After I prepare the environment for 5 to 10 minutes of mobilization, I would then do gastrocsoleus and fascial stretching. Now here's where we lose a lot of people because it takes a long time. It takes 3 to 4 times, 30 seconds to 1 minute for the gastroc, knee straight, 2 times a day for 6 to 8 weeks before we have a true improvement in muscle length. Next is knee bent to get lower into the leg and Achilles to bias soleus muscle. The soleus does not cross the knee, unlike the gastrocnemius, which does, which is why we have to keep knee straight to stretch it and knee bent to stretch the soleus. Again, if I don't hold this for 30 seconds to a minute, 3 to 4 times twice a day, the tissue will never improve in flexibility. And thus, every box of orthotics should say, see your doctor of human movement first. Next is a fascial stretch. This is best done on a wall, and this is why we must have great toe extension. If I can't extend the big toe and pull the arch up slightly to stretch the fascia, or all of the toes in extension, I will never be able to truly improve the mobility and extensibility of the plantar fascia. And just like the other stretches, I'm holding 30 seconds to a minute, 3 to 4 times, twice a day. So this program is going to take you 12 minutes in the morning, 12 minutes in the evening, and that's just on the stretching. And then you have to add mobilization. So that's 20 minutes in the morning and 20 minutes in the evening. For those of you who have recurrent cases, you sometimes have to wear a resting night splint to hold the tissue in a stretched position. And those folks that have horrible chronic plantar fasciitis might have to wear it for 8 to 12 weeks. So if you like this video, please share it with your friends, family, patients, and colleagues. Anybody with heel pain should have a good self-care mobility and flexibility program to improve the health of their legs, feet, so they can walk and stay active for the rest of their lives. Take care and see you all again soon.